There's been a lot of controversial data over the years, and this goes back as far as probably the early 2000s, suggesting that androgen deprivation therapy increases cardiovascular risk, but many of the data that has emerged has really been based on what we call retrospective studies. The data that comes from these retrospective studies really is based on just data that's been extracted from either data mines, which includes the SEER database and CAPSURE databases, or even the insurance databases that are there. And unfortunately, none of the questions regarding cardiovascular health was really asked in those retrospective studies. It's just gleaned out of the databases per se. What has emerged over the course of probably the last several years is the emergence of cardio-oncology and studying drugs that affect the cardiovascular system. So androgen deprivation therapy has been studied by a lot of different people. The data has been inconclusive, again, mainly because of the retrospective nature. What's now come forward is the fact that there may be subtle differences in using a gonadotrophin-releasing hormone agonist versus antagonist. There's some preliminary data that was presented by Peter Albertson a number of years ago, looking at least 6 prospective clinical trials that suggest that perhaps the use of a GnRH antagonist actually reduces the relative risk of a cardiovascular event by about 56% compared with the absolute risk reduction of about 8.4%. So clearly there's a benefit.